The opioid epidemic facing our country is one of our greatest public health challenges, stealing tens of thousands of lives from us every year, even though we know that addiction is a treatable disease.
The situation as it relates to opioids is completely overwhelming us. And I told a group a couple of minutes ago, when interacting and when understanding and discussing the opioid crisis, there's no sharp person that I've seen or heard that comes in with any hubris. In other words, there's a lot of humility here. This is a system, and this is a crisis that is grabbing people and destroying families and ruining lives. And there's not a lot of clean hands here. But the days of a big percentage in being paid at pointing fingers, there's really not much of a percentage in that. And I think we're going to be much better off if we realize we can do much better. There's government statutes that are in place that have been complicit in this. There's regulations that are in place that have been complicit in this. There's provider activity, there's industry activity, and so forth. Okay, so we all know that nobody's hands are clean necessarily, and the smarter move is for us to take one step and another step and another step. And I think the illusion that we could come under is to think we're going to come up with the big plan that's going to fix the opioid crisis once and for all. And if we're chasing the big plan, it's a pipe dream, and we ought not do that. What I am proposing is that we take a number of steps, take one thing and another thing and another thing, and it can be cumulative, this, and then be able to evaluate our success on a cumulative basis.
I've seen the toll it can do on families, on young children who lose their parents, and an overloaded foster care system. And working together, we're just going to have to address this. I know our hospitals have seen the effects of this crisis. You've, in fact, have had a front row seat with respect to the terrible effects of this epidemic. Our emergency rooms are at capacity. Our first responders are overwhelmed. But again, by working together, I still have faith and a deep conviction that we can help improve treatment options and save lives ultimately. That's why I introduced one piece of legislation, bipartisan in nature, called the Opioid Addiction Risk Transparency Act. The President recently signed this into law as part of the FDA Reauthorization Act of 2017. The legislation offers doctors better information about the risk of addiction and encourages them to communicate that information with their patients. We also took needed action collectively in Congress, working with the administration, with the Comprehensive Addiction and Recovery Act. I know all of you are familiar with that piece of legislation. But a lot more work remains to be done. In some areas, we know what the right answers are. We just need to scale up those interventions, those approaches that we know are working. In other areas, that knowledge base needs to be more broadly disseminated so folks in Indiana understand what's working in other geographies. And we need to continue to experiment in those areas where information gaps and treatment gaps exist.
The scourge of the opioid crisis around misuse and addiction has wrought destruction on so many families, and this is something that I know the President saw personally during the campaign as he traveled around the country, hearing from families that had suffered from opioid losses. From a federal policy standpoint, we are obviously very sensitive to how providers and others across the healthcare system have been responding to government and other incentives. But the status quo around that has to change. So we in government must take a clear look at how we can better support collaboration among those involving patient care, and that providers must consider the needs of each individual patient to ensure access while avoiding problems around oversupply that can lead to diversion or addiction.